Hi, my name is Callie Markson. I'm doing a head-to-toe assessment for Presentation College. This is my patient, Nikki S. Her birth date is 1/2/90. I provided privacy as I entered the room, and I've washed my hands. I'm looking at Nikki's posture, and it's good. Her hygiene is clean. She is able to speak and hear. She is oriented ×3, person, place, and time. She walked in here with good gait. I'm going to look at her skin throughout the assessment, and I'm looking for color, pigmentation, moisture, temperature, turgor, texture, and any lesions present. I'm going to start with your head and work my way down to your toes. I'm going to first start by palpating your scalp and looking for any lesions, bumps, or lumps. Perfect. I'm also going to palpate your scalp and let me know if you have any pain or tenderness. Any pain with that or tenderness? Okay. I'm also looking at your face for symmetric features. I'm also going to have you smile for me, puff out your cheeks, stick out your tongue, good, and frown for me, good. This is checking cranial nerve 7, and that's just making sure that everything is intact. I'm also going to check your temporal artery. Good, and I'm going to check for TMJ, so if you can open your mouth and down, both, and side to side. Good, any pain or tenderness with that? I don't feel any popping or clicking, and I shouldn't. I'm also going to be checking for your vision. So I'm going to have you hold this card 14 inches, and I'm going to have you read the bottom line possible. Most bottom line. 9, 3, 7, 8, 12, 6. Good. And cover your other eye. Good. 9, 3, 7, 8, 2, 6. Okay, and we would do this on both eyes, and your vision is 20/20. I'm also going to check your pupils. Good, and your pupils are equal. They're reactive to light and accommodation, so that is good. I'm also going to be looking at your corneal reflexes and to make sure that the light is in the same in both eyes. I'm also going to have you follow my pen. Perfect. And during this time, we are checking cranial nerves 2, 3, 4, and 6. I'm also going to have you take this and cover this eye for me. And I'm going to have you tell me when you see my finger come into your view. Good. I'm also going to check for your red reflex. Your red reflexes are present. Now I'm going to inspect your ears for any lesions or bumps or lumps. And they look good. They're symmetric. I'm also going to palpate. Let me know if you have any pain. Any pain with that? Good. We're also going to check hearing. So I'm going to whisper 3 things to me, and I want you to tell me which 3 things you hear. Elephant, tractor, pineapple. Good. And on the other side? Elephant, tractor, pineapple. Good. I'm also going to be checking the Weber test, which is checking for hearing in your ears. And I want you to tell me if you hear it in both, or right or left, and when you stop hearing it. Good. And I'm going to do it in the back of your ear, and I want you to tell me when you don't hear it anymore. in the front of your ear. Okay. Good. And that's testing ear conduction is twice as long as bone conduction, and that is normal. I'm also going to take a look in your ears. I'm going to pull the peanut up and back. Good. Good. And your tympanic membranes are shiny and pearly gray. There's no redness or any lesions in your ears, which is normal. I'm also going to be looking in your nose. And I'm going to be looking for your turbinates, your septum, and at your mucosa. And your turbinates are deep pink, and that's good. Mucosa is good, and your septum, no deviated septum, noted. I'm also now going to be checking the patency of your nostril. So I'm going to close one side, and I'm going to have you sniff and close the other side. And both nostrils are patent. I'm also going to check cranial nerve number 1, which is smell. And I'm going to give you a smell, and I want you to tell me what you are smelling. Good. With the eyes, I also checked cranial nerve 2, 3, 4, and 6. And with the smell, it was cranial nerve number 1. And so now we're going to move on to feeling your lymph nodes. And I'm going to check your periauricle and your parotid and your facial. Also going to feel for your submandibular and your sublingual and your submental. And then we also have the posterior auricle. Any pain or tenderness with that? Okay, good. And I'm going to check your trachea for midline and to make sure that everything, there's no lumps or bumps and everything is normal. So I'm going to feel for your trachea to be straight. I'm also checking for your thyroid gland. I don't feel it, which can be normal. I'm also checking for your carotid artery, which is strong and present. I'm also going to feel your lymph nodes, your subclavicle lymph nodes. Good. And I'm going to test cranial nerve number 11, which is your muscles. So if you can push up, good, and go down, good. And then I'm also going to listen for a carotid bruit. I don't hear any swishing, and I shouldn't. Now I'm going to inspect your mouth. I'm going to be checking for cranial nerve number 9 and 10, and I want you to open your mouth and say ah. Good, and then you realize good. Your tonsils are present. I'm going to also check in there for any lesions or any sores, and everything looks good. Your tongue is moist. I'm going to have you stick your tongue out for me and move it up and down. Good, and side to side. Good. And that's checking for cranial nerve number 11. Nope, number 12, excuse me. I'm also going to check now for jugular vein distension. And check the range of motion of your neck. So if you can put it down and up and side to side. Good. Now we're going to do your upper extremities. So I'm looking to make sure everything is uniform. And I'm going to inspect your muscles to make sure that there is no bulging and everything is good. I'm I'm also going to check the range of motion of your shoulders. So if you come out and up and down and back and front, okay? And then I'm also going to check the range of motion of your elbows and your wrists and your fingers. And then if you could go like this with your fingers on both sides, good. I'm also going to check your deltoid muscle. So if you can keep your arms out like this and push down on me, and push down and pull up, sorry. And then I'm going to have you bend your elbows, and I'm going to have you resist me and push against me, good. I'm also going to have you squeeze my hands, good. And I'm going to have you lift up and push down, good. And spread your fingers, and I'm going to have you resist me pushing them in, good. Checking your thumb also, great. Okay, and then I'm also going to check your reflexes. And first I'm going to palpate the brachial pulse and the radial pulses. Now I'm going to check your bicep and tricep reflexes. And brachial, radial. Good. And I do that on both sides. And now I'm going to have you lay down for me. Perfect. And I'm going to have you lay on your stomach. And I'm going to be looking for your spinal process to make sure that it is aligned and everything is equal and symmetric. I'm also going to be checking for thoracic expansion. So I want you to take some good deep breaths. And once more. Good. I'm also going to check for tactile fremitus, which I want every time I put my hands on you, I want you to say 99. Good. And I'm also not feeling any bulges, which I shouldn't. Everything is symmetric. I'm also going to percuss. And I'm going to check for CDA tenderness, so let me know if you have any pain. Any pain with that? No. Okay. And I'm going to also take a listen to your lungs. And now you can turn over to your back. Good. And again, I'm inspecting for symmetry and any lumps or bulging. I'm going to check for thoracic expansion again. Front here. Take some good deep breaths. Good. And also tactile fremitus. So if you could say 99. Good. And everything is symmetric and equal. I'm also looking for the point, the maximum impulse, and that's located at the 5th intercostal. Good. And I'm also going to now listen to your lung sounds. Hold on, I'm going to percuss first. Take a listen. I'm going to listen to your apical pulse for 30 seconds. Good. And the rate is 60 and normal. I'm also going to be listening to different heart sounds with the diaphragm and the bell of my stethoscope. I'm going to listen to aortic, pulmonic, Ear's point, tricuspid, and mitral. And with the bell of my stethoscope, aortic, pulmonic, Ear's point, tricuspid, and mitral. Good. Next is your stomach, which I'm going to inspect. And I'm just going to look to make sure that the umbilica is midline and that there's no bruising or any skin discolorations or pigmentation. I'm also checking to make sure that your bowel sounds are present, so I'm going to take a listen to those. Good, and bowel sounds are in all 4 quadrants. And I'm also going to do palpation to see if you have any tenderness, so let me know if you do, and I'll do light touch first. Any pain or tenderness. I'll also do deep palpation, looking for your liver and your spleen. Any pain or tenderness. Everything feel okay? All right, I'm also going to percuss. And at this time, I'm going to try and check for aortic bruising. And I don't hear any swishing, and I shouldn't. I'm also going to tell you that at the same time every month, you're also going to be doing a breast exam, a self-breast exam, and you're going to check the lymph nodes in your axilla first. And this is where you will palpate to see if you feel any lumps, bumps, or tenderness. You're also doing this with each breast. You can do it in a circular motion, or you can go upward, or you can go the zigzag pattern. You'll do that every month, and if you notice any pain or tenderness that you haven't had there, any lumps or bumps, let your provider know. I'm also going to check for your femoral artery. And your inguinal node, horizontal and vertical, and I want you to tell me if you have any pain. Any pain? Good. And we'll be checking that on both sides. I'm also, while I have you laying down, I'm going to tell you that if you're a male, you would do a testicular exam, and you can do this best in the shower, and you would take each testicle and in your hand and feel for any lumps, bumps, or abnormalities. You would also take your thumb and your finger, and you can move up the epididymis to feel for any of those along that track as well, or anything in your scrotum. And then I'm going to check the range of motion of your legs and your hips and your knees and your ankles and your feet. So I'm going to have you put chest up to your chest and down. And then I'm going to have you make a 4 with your foot. There you go. And back. Good. And then I'm going to have you bend your knees. Good job. And your ankles. And then move your ankles up and down. Good. And then I'm also going to have you wiggle your toes. Good. And I'm also going to have you, I'm going to feel for any bulging or abnormalities. Do you have any pain or tenderness anywhere? No. Good. And everything looks symmetric. Your left matches your right. And then I'm going to have you push up on my hands. Good. And then I'm going to have you push down. Good. And I'm going to do your feet, and I'm going to have you push up. Good. And down. Good. And wiggle your toes for me. Good. And then now I'm going to have you sit up. And at this time, I'm going to check for your popliteal pulse. I might have to move the screen down more. And your tibial pulses. And your pedal pulses. I'm also going to check your reflexes. And this is the patellar reflex. And the ankle. Good. And I'm going to check for sensations, both on your upper and your lower extremities. And let me know if you feel any sharp, soft, or vibration. Good. And on your feet. And we would check both upper and lower extremity light sensation, vibration, and touch. I'm also going to have you stand up for me. And I'm going to have you walk back and forth. Okay, and then side to side, or heel to toe, excuse me. All right, and then I'm going to also have you stand with your eyes closed and your hands out. Good. And that's checking Romberg, and that is cranial nerve 8. All right, and then I'm going to have you bend down and touch your toes. And this is checking for your spinal process to make sure that it is aligned. And you can stand back up. Okay. And I'm going to sit back down. And I think that completes your head to toe assessment. And did you have any pain or tenderness anywhere during your exam?